Welcome back to KX News. Well, today is Registered Dietitian Nutritionist Day, and here to talk about what's happening in the nutrition world in our KX conversation is registered dietitian Rachel Iverson. Rachel, thanks for being here.
Thank you for having me.
Absolutely. So now, how long have you been a dietitian?
I've been a dietitian for about 6 years.
And what have those 6 years been like for you?
You know, it's been a roller coaster, actually. I've worked inpatient, I've worked outpatient, I've managed nutrition, cardiac rehab, I've done community nutrition. Now I'm a sports dietitian, so I specialized. So I've been busy for these 6 years.
Sure. So what does it mean to have a special month for people like yourself?
Yeah, well, this month is all about education. So what can we do to provide kind of a layer of calm and understanding about nutrition? And, you know, there's a lot of media out there, a lot of social media that kind of can be really misleading and really scary for people. So registered dietitians are really trying to create a safe space where, you know, science is the above all for nutrition, and to make that easy to understand for our patients. Because when you talk to somebody about nutrition, you have to take in so many factors to make it not only the science, but also what's their budget, what's their comfort cooking level, what is their family history and their genetic history, what disease states are they trying to work in, what are their goals for their health. And taking all that and putting it into a manageable plan for them can be really tough, and it can be something a lot of people struggle with.
Right. You know, we all want to be as healthy as we can, and there are, as you said, so many options out there. So just tell us about some of the options out there, but some of them are healthy, but not all of them are, correct?
Yeah, there's a lot of misinformation out there, unfortunately. And I think a lot of it is from a positive space. People are really wanting to help. But again, when I became a dietitian because I really thought I knew a lot about nutrition. I was like, oh, this will be easy for me. I'm already so good at it. And I wasn't. I really wasn't. And I was trying to give people advice even when I was at that stage in my life. And I think a lot of people are really just trying to help, but they don't have the educational background to provide nuanced information and to understand how science updates and how that impacts, as well as the emotional connotations that come with a lot of recommendations. So it can take a lot of work to put that all together. And honestly, I've been studying human metabolism for about 10 years. And I'm just starting, like, it's clicking pretty good now. And it took that long.
Sure. And of course, there's always new data coming out all the time, correct?
Absolutely. In fact, the Academy of Nutrition and Dietetics recently released a brand new position paper on the treatment of patients who are dealing with BMI over 30, so overweight or obesity. And they're recommending medical nutrition therapy not only as a prevention tool, but also in the management. Because a lot of my patients who are struggling with body composition, with weight, do not get referred to a dietitian. They either seek me out on their own or they have to ask directly. It's not always an automatic referral. And so that can be a real barrier because our docs don't always have the time. You know, they're seeing you for those 15 minutes, they're doing the best they can, but they're rushed because they have a lot of people to see. And my job is to sit with you, to provide education, to go through how it might be impacting your day-to-day, what your habits look like, and put that together. So the Academy of Nutrition and Dietetics is recommending 5 visits at minimum with a registered dietitian for treatment of those disease states.
Okay. Rachel, thank you so much for being here. It's always a pleasure to have you and get some information about being healthy. And of course, we have a bunch of resources Rachel has provided for us, and we'll put those resources inside the story over on our website, kxnet.com.